Hey, this is Dr. Schmidt again. I'm here with Miss Holiday, who comes in 1 year after a gastric bypass. We're going to talk with her and see what she has to say. So, here you are looking beautiful. It's been a year.
It has.
And you were telling me that you were a diabetic for 3 years.
Yes, sir.
3 years, and you were on 2 different medications.
Glyburide metformin.
And they talked about maybe you might need insulin, but you certainly weren't coming off of your diabetic medication, and you wanted your diabetes gone. And so what did you decide to do?
I decided to have gastric bypass. I thought about it about 8 years and had just had enough with the medicine, and that was the final straw. They didn't take me off.
And so after the surgery, how long did it take for your diabetes to go away?
I went home with a sliding scale for 1 week.
For 1 week, you took
1 week.
a few shots of insulin.
I took usually 1, maybe 2 at the most a day.
And then you didn't need those shots anymore, didn't need pills
No
anymore.
medicine, nothing. No.
No, and haven't had it since.
No. As a matter of fact, it's a little bit too low now.
You're
It's a little too low now
A1C.
that I am considered clinically cured
Yeah.
by my insurance company.
Absolutely.
So.
And, it's a funny thing. I have people who get on Facebook and go, you can't cure diabetes. And I'm thinking, well, if you haven't needed medication for 10 years and your sugars are normal, what do you want to call it? You can call it what you want to. But, if the patient calls it cured, I certainly call it cured. If somebody has cancer and it gets cut out and they get chemo and they don't have any evidence of cancer for 10 years, that's a cure.
Right.
So, I don't think your diabetes is coming back. So I think it's a permanent remission.
Not.
Yeah.
I do what I'm supposed to do, and I eat when I'm supposed to eat, and I don't eat when I'm not supposed to eat.
And the number one killer in America is cardiovascular disease, which diabetes contributes to, and which hypertension contributes to. And you had high blood pressure.
I did. I have not had it for a year. Not had it since about 2 weeks after surgery, and that was because of the medications I was on then. So no acid reflux anymore.
Oh,
I've had it since not had that medication since the night before surgery.
So
it's
that's
good.
nice. That's a good benefit
It's
too.
a good thing. It is.
And you lost over 100 pounds.
I did.
Yeah.
So.
Right now, you're saying you just still don't get very hungry, do you?
No, I don't.
Yeah. That's a wonderful thing
remind
because
myself
you
to-
dieted before.
I did.
And what was the hunger like when you were dieting?
I was a stress eater, big time stress eater, and I, would do low carb, and I was hungry and wanted the carbs, and just a little nitpick here and there, and got tired of that too.
Yeah.
Just that doesn't get rid of your diabetes.
Yeah.
That doesn't give you 100 pounds weight loss in a year.
Yeah.
And that's just the icing on the cake.
Yeah.
Really, to me.
Wonderful. Well, thanks for sharing that with our patients.
Sure.